Did you know that bird flu can affect not only birds, but also other animals such as cats? A recent event in Texas has brought this fact into sharp focus. More than half of the cats at a local dairy farm died after consuming raw milk from cows infected with highly pathogenic avian influenza, also known as HPI H5N1. It's a chilling testament to the hidden dangers of bird flu. You see, bird flu isn't just a concern for birds. This viral disease is zoonotic, meaning it can jump from animals to humans, and sometimes, as we've seen in Texas, from one animal to another. The virus spread from cows to cats through the consumption of contaminated milk, a route of transmission that underscores the insidious nature of this disease. What's more, the cow-to-cat transmission is not an isolated event. Cases of bird flu affecting other domestic animals like dogs have been reported in multiple countries. Even humans aren't immune. A veterinarian in New York City was infected with bird flu after caring for infected cats, emphasizing the potential risks this disease poses to us all. The implications of bird flu are far-reaching. For animals, it can result in severe illness or even death, as we've seen with the cats in Texas. For humans, though infection is rare, it can be deadly, particularly for those with pre-existing medical conditions. But it's not just about the direct impact on health. The presence of bird flu can also disrupt local economies, especially those dependent on poultry farming. A single case can lead to the culling of entire flocks, affecting livelihoods and food supply chains. This alarming incident prompts a deeper look into the potential risks and implications of bird flu in our daily lives. It's a stark reminder that we must stay vigilant, understand the risks, and take appropriate measures to protect ourselves and the animals in our care. But how did this happen? How did a bird flu virus infect cows and subsequently cats, you might ask? Well, the virus believed to have originated from wild birds. Yes, you heard right, wild birds. These creatures, beautiful as they are, can sometimes carry diseases which can easily spread to other animals, in this case, dairy cattle. Now, how did it get from cows to cats? The answer lies in a seemingly harmless act, the consumption of raw milk. More than half of the cats at a Texas dairy farm tragically lost their lives after consuming this milk, which was contaminated by the highly pathogenic avian influenza, H5N1. This highlights the importance of proper hygiene and safety practices in handling food products to prevent disease transmission. This unfortunate event has prompted the Centers for Disease Control and Prevention, or CDC, to issue new guidance for veterinarians treating H5N1 cases in cats. The CDC emphasizes the importance of protective measures for these professionals as they come into direct contact with infected animals. In a world that's more interconnected than ever before, we must remember that the health of one species can significantly impact the health of others. This is not just about cats, cows, or birds. This is about all of us. This unfortunate event underscores the importance of vigilance and proactive measures in preventing the spread of diseases. It's a stark reminder that we are all in this together, and we must all play our part to keep each other safe. So, what does this mean for us and our furry friends? Well, the recent events have shown us that the bird flu isn't just a threat to birds. It's a real and present danger to other animals, and even to humans. We've seen this with the tragic case of a veterinarian in New York City who contracted bird flu after caring for infected cats. This isn't just an isolated incident, it's a stark reminder of the potential risks we face and the importance of vigilance and precaution. In response to these threats, the U.S. Department of Agriculture is taking proactive steps. They're currently conducting tests on ground beef for H5N1, the strain of bird flu that's caused so much concern. They're studying how cooking beef could reduce the risk of transmission. This is a crucial part of the effort to understand and contain the spread of the virus. And then there's the matter of vaccines. The FDA has approved bird flu vaccines for humans. But getting these vaccines into the hands of everyone who needs them is a massive undertaking. It would require mass production, distribution, and administration. It's a monumental task, but one that we must undertake if we are to protect ourselves and our loved ones from this threat. While bird flu remains a threat, Being informed and taking precautionary measures can go a long way in ensuring the health and safety of both humans and animals. This is a battle we can win, but only if we face it head-on, armed with knowledge, and prepared to take the necessary steps to protect ourselves and the animals we share our lives with.